Mental health is always around us. It is something that is very close to us actually. What happened is that we use augmented reality to actually mimic or even illustrate the symptoms out for the students to experience. By having that, it actually helps the students to develop the empathetic response. Having the empathy is important in nursing, especially in mental health care, where symptoms are only experienced by the patients themselves.
For me, I've always been a very experiential learner. Like, just reading textbook, all this it's very difficult for me to really understand the whole content that is what is learned. So I believe that this step has really allowed me to not just have fun, but also allow me to have a very interesting experience, maybe with my classmates as well when we talk about it, and then that helps me with my learning a lot. I was posted to a neurological ward. I have a patient who constantly say that there are like cockroaches around, and he also mentioned that his skin is very, very oily, all these things. But despite checking for him and feeling his skin, I cannot see where are all those coming from. So before learning this module, I thought that he was just lying to me. So like this module and this app as well allows me to really truly comprehend what the patients are going through.
I definitely don't think I see it as a replacement for traditional classroom didactic teaching, but it really does add to the experience, especially like during this time if we conduct like classes over Zoom, the experience becomes a lot more detached. Then being able to bring this app into the picture and have us as a student actually experience it for ourselves rather than have a lesson over Zoom, it helps to enhance the experience that you're actually doing something. Then hopefully maybe you'll be able to remember it better, maybe be able to internalize things better as well.
It has complemented the teaching process, I think, allowing students to have the realism at their own environment. We are in the midst of actually discussing some collaborations with different organizations. Within the school itself is with the medical school. With external agencies, we are actually looking into using it to teach caregivers.
It's very important for society not to stigmatize with mental health issues, because all of us are prone to mental health conditions. Regardless of how old we are, all of us might have a chance to get it. And in a way, we want to create a society that is more forgiving, that is more inclusive. So in a way, to create this healing environment, it's very important for all of us to understand what mental health is really about in order to prevent this stigmatization to occur.
After they went through the rehabilitation, you can see that they are actually back into the society, living among us, working among us. I think that is something that really satisfies a person who is working with mental health patients.